Have you ever been sitting in an emergency room thinking, I've already seen the nurse practitioner or doctor, so what am I waiting on now? Or maybe you've wondered, why is this taking so long? If you've ever asked yourself those questions, you're not alone. After more than 25 years in healthcare, I've learned that some of the most important work in emergency medicine actually happens after your first evaluation. So today, I want to pull back the curtain and help you understand what may be happening while you're waiting. Hi there, I'm Kisha Pickford, a nurse practitioner, and on this channel, we have real conversations about healthcare, personal growth, emotional resilience, and lessons learned after more than 25 years in healthcare. And today's question is one I hear often. What am I waiting on after I've already been seen? So let's talk about it. Many people assume that once the provider walks out of the room, the hard part is over. But in reality, that's often when the next phase of your care begins. I've gathered information. I've examined you. I've listened to your concerns, and now I'm asking myself, what do I think is going on? What do I need to rule out? What tests will help answer those questions? And what is the safest next step for this patient? That thought process takes time, but usually I'm not working alone. Healthcare is a team sport. One thing I wish more people understood is that healthcare isn't just one person making one decision. It's an entire team working together. As your provider, I may have a plan, but I still depend on many other healthcare professionals to help move that plan forward. If I order blood work, I'm waiting on the laboratory team to collect it, process it, and report the results. If I order an X-ray, a CT scan, or an ultrasound, I'm waiting for imaging staff to perform the exam and for a radiologist to interpret what they see. If I need another opinion, I may be waiting to speak with a specialist before making a final decision. And throughout all of this, nurses are monitoring patients, giving medications, reassessing symptoms, updating vital signs, and communicating important changes. Healthcare is truly a team effort. While you may only see one provider, there are often many people working behind the scenes on your care. Sometimes we're waiting on information. Medicine isn't just about making decisions. It's about making informed decisions. Sometimes we need lab results. Sometimes imaging gives us the answer. Sometimes it raises new questions. Sometimes medication needs time to work before we know if it's helping. And sometimes we repeat blood work to make sure things are improving or not getting worse. Waiting doesn't always mean nothing is happening. Often it means we're gathering the information we need to make the safest decision possible. Sometimes we're waiting on other teams. Another thing patients don't always realize is that emergency departments don't work in isolation. We work closely with many other departments. We may be waiting on laboratory results, radiology interpretations, respiratory therapy, pharmacy, cardiology, surgery, orthopedics, neurology, and hospital medicine. Each of those teams plays an important role depending on what's happening with your health. Sometimes several of those conversations are happening at the same time. And sometimes we're just watching. This surprises people. Not every patient needs another test immediately. Sometimes the safest thing to do is simply observe. Did the medication help? Is the pain improving? Is the fever coming down? Is the breathing treatment working? How are your repeat vital signs? Those answers take time, and that time is part of your treatment. Even going home takes time. People often think discharge is the easiest part, but even sending someone home safely takes work. Instructions have to be completed. Prescriptions may need to be written. Follow-up recommendations need to be explained. Questions need to be answered. We want you to leave understanding what happens next, not simply just walk out the door. After more than 25 years in healthcare, one thing I've learned is this. Waiting doesn't always mean nothing is happening. Often it means many people are working together to make sure you receive thoughtful, safe, and appropriate care. Healthcare isn't just one provider making one decision. It's a system of people working together toward the same goal, helping you receive the care you need. The more we understand healthcare, the less intimidating it becomes. And while I've shared my perspective today, I know many of you have experiences and questions of your own. And I'm curious, what part of an emergency room visit has been the most confusing to you? Or is there another healthcare topic you'd like me to explain in a future video? Let me know in the comments below. Well, I don't know who will see this today, tomorrow, or even years from now, but this is my story and this is my perspective. I'm Kisha Pickford. Thank you for watching and thank you for being here. And I'll see you in the next video. Bye.